Hi everyone, I'm Abigail Salvador, 34 years old. I gave birth last December 2022 and I noticed na mas lumapad yung alar ko sa side ng ilong. And my concern today, yung paglapad ng ilong and then yung sa nose enhancement. For today's procedure, Doc Contessa will enhance my nose bridge and alar reduction non-surgically. So don't forget to subscribe and hit the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll discuss about how to narrow a wide nose. Before that, let's welcome Miss Abby.
Hello everyone.
Yeah. How young are you, Abby?
34 years old now.
Okay. So Abby has a history of like an accident in the past, hitting her nose onto the ground, right?
Yes,
from a bicycle ride.
By accident daw.
Yes, and she had this laceration on the dorsum of the nose. And did they do a stitch there too?
Yes, doc.
Okay. And we noticed that her nose is kind of like crooked, or it's like skewed a little bit to the right side.
Yes, doc.
And naturally, the width of the nose, the alar width is wider. Okay, so this is something you inherited.
Yes, doc.
Something genetics.
Yes, and lalo pa pong nag-wide nung nanganak.
Oh yeah. Another thing is when we age, okay, and even like during pregnancy, there are physiological changes happening in our system, in our body. So sometimes this part of the nose, the lower third, it droops down, it widens.
That's right.
Because of some soft tissue changes there, like tissue volume changes that happen during like pregnancy or when we age. Okay, so Abby, what do you want to achieve today?
Nose enhancement and alar reduction, doc.
Yes.
Thank you.
Without surgery. We want something like a procedure, of course, minimal to no downtime. It will give you a natural, instant result. Abby doesn't want to go through the knife, right? Doesn't want to have cutting. Because you had like cesarean sections?
Yes, doc.
Yeah.
Cesarean.
So she doesn't want to have this general anesthesia anymore. So all of those things. So for those individuals who really wanted to enhance their nose without surgery, you have an alternative right now. So we'll show the treatment, the procedure when CSA Medical Aesthetics return. And we're back, so we're doing a procedure, non-surgical enhancement of the nose for Miss Abby, okay? So our nose is in the middle third of our face, okay? So middle third, the demarcation will be our eyebrow here and the subnasale to the tragus of the ear, okay? So what we do in terms of the assessment of the nose, okay? So you have to take note of your nasofrontal angle here, that angle. You will check on that on the profile view, and then check on the so-called nasolabial angle there, and then inspect the radix height, the rhenion height, and also check for any supratip break here. Okay, so that's in the upper part of the nose. And then also inspect for your columella length, and at the same time the shape of the nostrils. Okay, most of the time we see the left and right nostrils not symmetrical. One side can be circle, one side can be triangular. So we always explain to everyone that we have the so-called inherent asymmetry. Okay, so we can inspect on the lower part. So we notice that this one is elongated than the left side. Did you notice that too, Abby? Right? So this is kind of like rounded, circular, and this is kind of like a little bit of rectangular. Okay, now if you want to check on the so-called alar width, for us to have the ideal alar width, what we do is inspect the so-called intercanthal width. So it should be within that center vertical fifth. So when we do like divisions of the face, the so-called rule of fifths or 5, so the center fifth, the vertical center fifth, your alar width should be within that, or the so-called distance between your two, like your medial canthi here. So what we check on Abby right now, so Abby, okay, so it's not within our intercanthal width. So Abby wants to correct that. Okay, so when we ask Abby to smile, also smile, Abby. Okay, so you will notice also the flaring of the alars because of your muscles, the dilator muscles that widens further your alar tissues. Okay, so we want to make the alar width enter that so-called intercanthal width. Okay, so in terms of our markings, our surface landmarks, we follow those. Now for injectors or those doing non-surgical minimally invasive procedures, of course we should be aware of the blood supply of the nose. Okay, so from the facial artery, so we have the branches labial vessels, and then the ones that go to the nose, so we have the inferior alar vessel, and then we also have the lateral nasal vessel, and then there's an angular branch there which could communicate with your supratrochlear vessels here, branches of your ophthalmic arteries. So those are important structures that we have to avoid. Okay, so here also on the radix we have the so-called intercanthal vein. So when we inject here, so some of our patients will have bruising here when we pierce that intercanthal vein. And another one, the so-called dorsal nasal artery also, that can be a branch of your supratrochlear or can be a branch of your angular artery. Because we have a lot of variations in anatomy, we have to be aware of all those significant blood vessels. Okay, that's why when we do procedures like this, as much as possible, we want to stay midline, and we should know the right anatomical layer where we place the material. Okay, so we have 5 layers: the skin layer, layer 1, layer 2 is a so-called subcutaneous layer, layer 3 is the so-called SMAS or fibromuscular layer, layer 4 is deep fat, layer 5 is above the bone and the cartilage already. So ideally, when we place material, when we do non-surgical method, we place in the above bone and cartilage. That's the safe place because the blood vessels traverse in the layer 3. So most of the time they are in the middle layer. Okay, so safety first. So that's for the anatomy. Okay, so let's proceed to our injection part. So as with any other injection procedure, we need to cleanse the area. We placed a topical numbing cream a while ago. We left it about 30 minutes and then cleanse again. And then I forgot to mention that Abby also had a history of like an accident on the nose. So she has this scar in that inferior part of the radix part here, or in the rhenion part. So we'll expect some of the difficulty in the penetration or insertion of our materials later on. Now with our injection method, okay, so entry point will be at the infratip, about 5 mm from your uppermost or the tip defining point there. Okay, we'll numb the area with your injection lidocaine. So I'll pinch and then numb the entry point there. So I'm using a lidocaine here, just a little bit of our lido, and then make your entry point. Make use of a gauge 18 or gauge 19 needle there to make a puncture for your entry point. Then I usually start with a hyaluronic filler loaded with lidocaine to help the area, the space where we want to place the PDO threads. So it's gonna give that tunneling effect as well, and then give comfort later on since it has a lidocaine. So I'm using like a gauge. You can use gauge 22, 23, or even gauge 25. And then in the layer 4, supraperiosteal, supraperichondrial, we can insert our cannula here. So I have a resistance in the scar region, which is expected. So there are adhesion or like fibrotic bands here. So there's a fibrosis, and then you just have to advance your cannula and reach your radix part here. And I normally like move my cannula to make sure I'm in the right anatomical layer and avoiding blood vessels there, and just inject slowly, small amounts in the region, okay? So we want to place this product material to give that substance volume on our tissue space, in our tissue space. And then after that, I'll go to the columellar region using the same entry point and direct it into the anterior nasal spine and push a product there. So usually I place 0.2 to 0.3 mil here, case-to-case basis. Sometimes I use up to 0.5 mil. Now I can inject now my PDO materials here into the dorsum of the nose to enhance the bridge part here, okay? And correct the malalignment or that kind of crooked nose, because we mentioned that it's a little bit skewed to the right side. So placing my PDO materials, this is quite a bleeder, and also correcting the scar on the mid dorsum already. So we'll check in a little while the height of the dorsum. So we're actually done with the dorsum, and we'll proceed with the tip columella projection. And I usually make a second entry point right now to really direct my material into the space of the columella here. So in the so-called intercrural space there and up to the anterior nasal spine. Make sure you insert the entire length of your cannula. Make sure that there's no thread extruding out, otherwise the entry point will not heal, it will not close, and it will cause those bumps or like nodules on the tip of the nose, and wound is not healing because of the threads still on the exterior or the exit point. Okay, so for my next technique, I'll be doing the so-called Alar bunching. Now I need to numb the sides or the Alar groove region. So I have a lidocaine here again, and inject a lidocaine into that region, into the canine fossa, and also place into this part towards the columellar region, numbing the area. Okay, so since we have a hyaluronic with lidocaine into the anterior nasal spine, so that one has a lidocaine too. So canine fossa, you're still okay, Miss Abby?
Yes,
so she's
no.
fine. So the goal is to make the Alar width go into that intercanthal width. Okay, so Miss Abby has a high tolerance. Expect later on that your upper lip, upper gum is also numb because we numb this area here. Okay, others can do infraorbital nerve block via injecting a 1 ml of your lidocaine into the inferior part of the infraorbital foramen, and using a gauge 18 or 19 needle, I make a tiny puncture there, and I'll use a spiral cog 60 millimeter length of my PDO cog thread there, and expect some pinpoint bleed, and direct your cog towards the opposite side there, and also make your exit point. So make a puncture on the opposite side. Okay, direct it there. Okay, and towards that exit point, so make sure your tip of your cannula will be exiting the point where you did your puncturing. So usually the Alar groove is the area we want to place this thread, so we can make another spiral cog there. So bunching ideally is you really have to press the tip of the nose like this, and then I insert another spiral cog there, 60 millimeter, and direct it again to your opposite puncture point. So we're already having the exit there, and then after that I make a suture of this 2 spiral cog just to stabilize my PDO threads. So we did the knot, and we will be cutting on the threads, these extended threads on the outside, and then we'll cut the other side. So we've done the combination bridge lift, tip columella projection, and Alar bunching for Miss Abby. We'll show the result when CSA Medical Aesthetics return. And we're back. We'll now show the result to Miss Abby. So here's our mirror, Ma'am Abby. Okay. So we did non-surgical nose enhancement, bridge lift, tip columella projection, and Alar bunching. There you go.
Doc, dream come true.
Yes. So she's happy
Ang
now.
gaan ng kamay ni Doc, solid.
Yeah.
Doc, dream.
Well, Abby already had nose thread lifting in the past where they did the bridge or the dorsum,
Yes,
and a little bit on the tip columella. And she was sharing with me that while we were doing the procedure, it's kind of like
painful.
Yeah, during that time, she was sharing with me, she's experiencing the discomfort in that insertion. But right now, when we did it, yes.
Sobrang gaan ng kamay ni Doc.
Yeah.
Ang pinaka-pain lang po talaga is the anesthesia.
Anesthesia injection,
But the
right.
procedure itself, sobrang ano po, hindi mo mafe-feel talaga yung pain. Kayang-kaya po talaga.
Right. So the discomfort was just from the lidocaine. So after the lidocaine injection, everything is already numb. So you don't feel anything anymore.
Yes.
So if we look at the dorsum of the nose, so on the profile view, you can see that slope. You can see a better nasofrontal angle and an improvement also of the dorsum in terms of the so-called straightness or alignment. So a while ago, we were sharing about the malalignment, or it's crooked or it's skewed to the right. So we were able to kind of straighten it, okay? And then the scar that we had here, you have here, we actually were able to kind of stretch the skin, and over time, because of the collagen tissue reformation, regeneration, it will also improve the scar on the dorsum. And then when you go at the tip, so it was rounded tip a while ago. So we minimized that round shape. We made it a little bit projected forward like that, and we showed the columella. And if you look at the Alar width, measure the intercanthal width, it's already within that vertical fifth of the face, especially for ladies. So we want a nose that's narrower, slimmer, and at the same time with good projection of the nose bridge and the tip also. Unlike for men, it's acceptable that they have wider, broader nose, but women, it should be narrower and slimmer. Okay, so making you look, of course, younger.
Thank you so much.
Yeah, actually, whenever we do nose enhancement, it makes you look younger. And at the same time, of course, you balance, made the nose within the right proportions, make it harmonious to the entire face. And more confident, right?
Dream
Yeah.
come true.
Yeah, thank you so much,
Thank
Abby.
you, Doc.
Okay, so initially, it's gonna be like some kind of like in the upper lip limitation of the movement because we did like bunching of cog threads here, okay? So some of the upper lip region, there's this kind of like some restriction in the movement, a little bit lang. And then it's normal to have some when you're eating, okay? So you just have to, for now, soft diet.
Yes,
Okay, minimize minimize any too much of the movement around the area, and we tell them to avoid dental appointments, like for the first 2 weeks, okay? Do ice compress in the area. You can take analgesics or anything to reduce any swelling after the procedure. Okay, so far that's it basically. Thank you so much, Ma'am Abby.
Thank you, Doc.
Yeah.
Dream come true.
Okay. For those who have questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. By the way, Ma'am Abby, do you have like a social media account that they can reach you or ask you some questions about this?
Yes, you can follow me in my IG, Abby Abs po.
Yeah,
Thank
you
you,
so
Doc.
much. So our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And our other videos, they are in our YouTube channel, Contessa Salvador. Please click the subscribe button and as well as like the video also. Okay, thank you. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.